Welcome back to the Deep Dive. Today we're jumping into something that's really moving fast. Large language models, LLMs, and how they're fitting into healthcare.
Hmm.
And our guide for this is actually a brand new study, a big bibliometric analysis that maps out, the whole research landscape.
Exactly. So our mission here is to really unpack what that study found. We want to look at the trends, the main themes, and where things might be heading for LLMs in the health sector, giving you the clearest picture of where this field is right now and what's probably coming next.
Okay, so let's start right at the beginning then. For anyone maybe not deep in the AI world, what are LLMs?
hmm
And what are they actually doing in healthcare already?
hmm
Are they kind of a superpowered detective for language?
That's not a bad way to think about it. LLMs are advanced AI systems. They use deep learning and NLP, that's natural language processing, basically, to understand and generate human-like text. So yeah, like a detective and maybe a writer combined. And they're already making a pretty big impact, helping doctors diagnose diseases, creating personalized treatment plans based on huge data sets. We even saw them being used for public health analysis, like during the COVID-19 pandemic. And they're also streamlining some hospital operations.
Okay, got it.
Yeah.
That makes sense. And the study we're looking at, it really highlights that the growth isn't just steady, it's, well, exploding, right?
Oh, absolutely explosive is the right word. Get this. The analysis looked at over 500 articles published just between 2021 and 2024.
Wow, in just a few years.
Exactly. And think about this. In 2021, there was only one publication in this specific area tracked by the study. By 2023, it jumped to 337.
337, that's incredible growth.
Yeah, it really signals a huge shift. It feels like the medical community is seeing these LLMs as potentially the next big frontier in care. And the citation counts are climbing right alongside, showing the research is getting serious attention.
So with that kind of explosion, who's actually leading the charge? Which countries are the main players in this research race?
Well, if you look at just the number of publications, the United States, Germany, and the UK are at the top. The US has the most, around 218 documents.
Okay, the usual suspects, maybe?
Sort of, but here's where it gets interesting. If you look at impact, like how often the papers are cited, the UK and Switzerland really stand out. They might have fewer papers overall, but their research is getting cited much more frequently on average. Switzerland actually has the highest average citation rate, 7.15 per paper.
So their work is really shaping the field then.
It seems that way, yes, very influential. And mainland China is also showing very high citation impact as well.
And drilling down a bit more, where exactly are these LLMs being applied most? What specific areas in healthcare are seeing this boom?
The study points to significant growth in using neural networks for diagnostic imaging, basically helping AI systems read or interpret medical scans better.
Makes sense. Imaging is data rich.
Exactly. And also huge strides in using NLP, that natural language processing, for clinical documentation. So understanding and summarizing doctor's notes, patient records, that kind of thing. Plus, they're really changing how patient data gets analyzed across lots of different fields. Internal medicine, radiology, surgery, oncology. What's also fascinating is seeing new keywords pop up more recently in the research terms like ChatGPT, education, chatbots.
Ah, so it's moving beyond just background data analysis.
It looks like it. It suggests LLMs are potentially moving into more direct clinical management roles, maybe even interacting with patients or helping with medical education.
Okay, this sounds incredibly powerful. The potential seems huge, but, there have got to be hurdles, right?
Yeah.
What are the big challenges highlighted in the study?
Oh, definitely. There are critical challenges. Data privacy is a massive one, naturally. Ethical considerations are right up there, too. And then there's the whole black box problem with some AI. It can be hard to understand exactly how the model reached its conclusion.
Which is a big problem in medicine, you'd think. You need to trust the reasoning.
Precisely. Transparency is key. Plus, these models require significant computational resources, and regulation is still working to catch up. The study mentions, for example, that as of early 2024, the FDA had only approved around 950 AI-driven medical devices in total.
Only 950 when you compare that to the hundreds of research papers just in this LLM niche.
Right. It really highlights that gap between the research potential and getting these tools safely and effectively into actual clinical practice. Building trust and proving safety takes time and effort. So the path forward really needs ongoing collaboration. You need the technologists, the clinicians, the policymakers, all working together. And a real focus on translational research, taking these exciting lab findings and turning them into practical tools that genuinely help patients.
So it's clear the potential here is just transformative for healthcare, but it's definitely a journey that needs Well, careful navigation around these significant challenges.
Absolutely. Which kind of leads to a final thought, really, for you listening. Given this immense potential and these very real challenges, how do we ensure that the way we develop and integrate LLMs in healthcare truly ends up benefiting all patients ethically and effectively?